Then can you call it as a placebo effect on brain?
Yes, exactly. Actually, this was the question I've been expecting.
Okay, that's interesting. Even before the modern medicine takes the role and incorporating spirituality there, years and years before people have been practicing that, right?
There are numerous studies which talk about positive psychotherapy for cancer patients too.
So as you say now, I remember a story, not a new research, it's about Hippocrates and he's one of his clients or the patients. So there is this lady called Telisila. She visited Hippocrates. After trying with a lot of physicians, nobody was able to understand what is her condition. Welcome to Nirva Podcast, where we talk about science meeting healthy living with Ayurveda and Yoga. I'm Dr. Abirami and I'm very pleased to welcome our guest speaker today, whom most of you are familiar with, our CMO at Nirva Health, Dr. Naveen. Welcome, Naveen. Dr. Naveen is an expert at healing people. I know most of his clients will agree with this. I can also personally vouch for this. Yes, so today we will discuss some interesting aspects of how to heal your mind from Dr. Naveen. Let me start with an interesting story of a Holocaust survivor who suffered from severe post-traumatic stress disorder for decades after enduring the horrors of concentration camp. Flashbacks, nightmares, and crippling anxiety plagued her daily life. During her EMDR or the eye movement desensitization and reprocessing sessions, Miriam revisited other traumatic emotions also. During a session, she particularly focused on a specific memory, that is the separation from her family upon entering the camp. As she recounted the memory while following the therapist's guided eye movements, the intensity of the emotions associated with it began to decrease. How beautiful it is, right? This is what we will be talking about today, and how your one-step Ayurvedic therapy can guide you through such processes, and more importantly, how wonderful the science of Ayurveda psychotherapy known as Smriti Meditation will help you in healing the total body and mind. Dr. Naveen, can you throw some light on it?
Yes, Abirami, of course. And thanks for hosting this podcast. Okay. And yes, Smriti Meditation, word by word, Smriti means memory in the Sanskrit language. And Smriti Meditation is a guided interactive meditation technique developed based on Sattva Vijaya Chikitsa.
Okay. So what is that term, Naveen, that you said it was looking very interesting, should have a deeper meaning? Can you explain more?
Okay, do not look confused.
Okay.
Sattva Vijaya means a type of treatment that ponders on the sattva of a person.
Okay.
And sattva is the essence of one's mind. So it's the mind control treatment or psychotherapy in Ayurveda. This is a unique approach to healing that focuses on the mind and spirit. Sattva Vijaya Chikitsa emphasizes the interconnectedness of the mind and body.
Okay.
So it believes that imbalances in the mind can manifest as physical ailments. This therapy goes beyond just the mind and incorporates spiritual well-being into the healing process.
Oh, that's interesting. Even before the modern medicine takes the role and incorporating spirituality there, years and years before people have been practicing that, right?
Yes,
yes. It's really fascinating.
The technological advances led to the change of focus of medicine from caring, a service-oriented model, to a technological cure-oriented model. And eventually, it forgot the care factor of medicine.
Yes, that's so sad.
However, in the past decades, if you see, physicians have attempted to balance their care by reclaiming medicine's more spiritual roots, right?
Yeah.
And spiritual or compassionate care involves serving the whole person, the physical, emotional, social, and spiritual. Such a service is inherently a spiritual activity.
True,
isn't
very
it?
true.
You know, Dr. Rachel Naomi Raymond, who has developed Commonwealth retreats for people with cancer, described how to treat people. She said, helping, fixing, and serving represent three different ways of seeing life. When you help, you see life as weak. When you fix, you see life as broken. And when you serve, you see life as hold.
Okay, that's a beautiful philosophy, right?
Yes, and serving patients may involve spending time with them, holding their hands, and talking about what is important to them. Patients value these experiences with their physicians.
Wow, that is something. It's a whole new dimension to look at things, right?
Yeah, right. And so, actually, Smriti meditation offers a unique perspective on this type of healing. It's about listening to people go through everything that they have to say, even things they have never thought were dug deep in them, such as things from the deep past. So, by venturing into the past, we might hold the key to unlocking a healthier and a happier present.
Okay.
Smriti meditation is a guided interactive meditation technique.
Usually, it's really a doubtful concept to believe, especially when it comes to, as you say, conditions like cancer treatment. How does this whole thing of spirituality or venturing into the past, etc., come handy in treatment of these conditions?
So, to call some science into it, there are numerous studies which talk about positive psychotherapy for cancer patients too. Here, this type of therapy effectively reduces emotional distress, depression, anxiety, and low self-esteem.
These are the things that they associate with the main condition, right?
Absolutely.
Okay.
There are studies that actually quote that the fellow doctors, every new batch who saw how this therapy works, were amazed and very impressed by the result.
The power of an empathetic relationship, even in the terminally ill patients, does work. But it can be happening in an individual client. But what do you think for a larger group of population? Do you think it really has the effect?
So there was this interesting case of a lady with breast cancer who felt immense guilt and believed that her past mistakes actually caused her illness.
Oh, really?
Can you believe? Yes. Yeah. And therapy helped her to see this wasn't true and focused on what she could control, such as understanding her disease and improving her relationships and fighting cancer.
Oh.
Over time, she transformed from feeling punished to feeling empowered.
Oh,
she even advocated for research in the same field.
Oh, that's great.
Amazing, right?
Yeah. So I have read this somewhere in the Journal of Psychiatry too. So by Norma Stalker, the woman was blaming her marital issues for getting cancer. She thought it was her punishment, right? And she was also quite fit and healthy and always into all the healthy habits. So when she got this disease, she was so devastated and she was blaming that it is because of her marital. So it's something similar, right?
Yes. And that establishes that the mental effects of such therapies are actually long-term.
But the therapies, psychotherapies, hypnotherapies, there are more newly established research on mental well-being coming up. So we wish to know, what is Ayurveda psychotherapy standing in all this?
Yes, that's what we must be talking about today. Because Ayurveda psychotherapy is what we call as Smriti meditation. It's not just regular psychotherapy.
Okay.
Where you will be asked to lie down on a couch and talk about your trauma and something that has hurt you. Like you say, let it all out once and for all.
Okay.
Smriti meditation is again a guided meditation. Actually, the key method is Sattvavajaya treatment, as mentioned before. Sattvavajaya refers to self-command, strength of mind or character.
Okay.
So we use this to resolve psychological problems, and the key method used are Jnana, which means knowledge. Vijnana, that means special knowledge.
Okay.
Thairya means courage for sensory control. And Smriti, which is memory.
Okay.
And finally, Samadhi, that's a meditative state.
So even in yoga, we have different layers. So the Vijnana, as you said, again, it's a scientific thing. And Samadhi is the ultimate goal of yoga, right?
Yes, this is how a session goes exactly. First, we ask the meditator to relax. Go for stepwise guided muscle relaxation from toes to head to attain a state of deep relaxation.
Okay.
Then we fix a goal through interaction, like a mountain or any place that the meditator sees first when you ask. And it can be a person too.
Okay.
When the meditator is involved in the interaction through detailed narration, the person gets focused on this theme.
Okay.
Eventually, the focus goes to the meditator's internally oriented experience to deepen their awareness.
Okay, interesting.
The meditator actually goes to the stage of Sopna, which means dream.
Okay.
A dreamy state.
Okay.
And this is when the guide asks the meditator to observe a few experiences or images to recollect memories. And this step is very important. Continuous interaction with the meditator goes into picking out the deep emotional memories, even those that the meditator does not realize is hidden within.
There could be a childhood memory or something which has been long forgotten from the conscious mind, right?
Of course.
Okay.
And this can actually sometimes cause an emotional outburst during the session.
Oh, okay.
And this helps them clean the deep negative emotions which log deep trance. And exposure to such transcendental state often exposes some revelations which help to realize the root cause of the problems. And recognition partially solves the problem.
Yeah, true that. Like when you know the root cause of the things, the journey becomes very easy for the healing, right?
Yeah, you got it.
Yeah.
By the repeated practice of meditation, the mind becomes tranquil.
Okay.
And the person transcends to a more subtle layer of existence.
Okay. Wow.
And in this stage, harmony between mind and body occurs.
Yes. Often we see our clients going pain-free after 3 to 4 Smriti sessions, right? So what exactly happens in the human brain during this meditation or any kind of meditative state? So what exactly is happening?
Smriti meditation is like part meditation, part hypnotherapy, and part regular psychotherapy.
Oh.
Meditation involves focusing your attention on the present moment without judgment.
Yeah.
This is what helps you become more aware of your pain sensations.
Okay.
When you practice meditation, your brain shows changes in activity in several areas, such as those involved in attention, emotional regulation, and pain processing.
Okay.
For example, one study which was published in the Frontiers of Human Neuroscience by Brigham Young University.
Okay, USA.
Which is USA, which found that mindfulness meditation increased activity in the anterior cingulate cortex.
Okay.
Which is an area involved in cognitive control.
Oh, yeah.
So this actually suggests that meditation may help people to better control their pain by regulating their emotions.
Interesting.
Yeah, of course. And another study in the Frontiers in Psychology found that meditation increased activity in the right anterior insula.
Oh.
Which is an area involved in interoceptive awareness. Which is being aware of your internal bodily sensations. This suggests that meditation may help people to become more aware of their pain sensations, but in a way that is less likely to cause emotional distress. And not just that, meditation also reduces pain by decreasing activity in the thalamus, which is an area involved in relaying sensory information to the brain. This actually suggests that meditation may help to reduce the intensity of pain signals. Reaching for the brain.
That's great, right? Like we take painkillers and people take a lot of steroids to control the pain. But this is amazing.
Yeah. So most of the cases I've seen or dealt with, whenever I consider that a client needs sessions of Smriti meditation, is when their mental traumas or past hidden experiences give them pain.
Oh.
Something that you call psychosomatic pain or illness.
Yes.
It can be a muscle pain in different parts like the neck, your upper back area, pain in the hands or different joint pains, even arthritis too.
Yes. Then can you call it as a placebo effect on brain?
Yes, exactly. Actually, this was the question I've been expecting.
Okay.
And I'm glad you asked that. A variety of factors are now known to either increase or decrease pain-related brain activation, including predictive cues, distraction, attention, expectation, beliefs, placebo, hypnosis, stress, anxiety, mood, and emotional state. You see, placebo also comes in the first list. Placebo works by activating the prefrontal cortex to create positive expectations that reduce pain perception. Mindfulness meditation, on the other hand, reduces the influence of expectation on pain. It seems to achieve this by reducing the activity in the brain regions involved in elaboration or analysis and appraisal or judgment of pain sensations.
Okay.
This suggests that as you practice mindfulness meditation, you move from reappraising pain sensations to simply observing them without judgment.
Interesting. So all these pathways, different pain pathways, come together in reducing the pain through meditation, right?
Yeah.
So you would have seen a lot of interesting cases in your practice. Can you share something with us?
Yeah, of course I can. But maybe, okay, let me not share the name for the sake of confidentiality. Maybe we can call her Sarah.
Okay, works.
So I remember Sarah being a 45-year-old mother.
Okay.
Mother of two, living in the suburbs of London. Sarah had always been active and full of energy. Managing her household, part-time job, and engaging in community activities. However, over the past year, Sarah's life took a different turn. Sarah started experiencing persistent back pain and frequent headaches. The pain was unrelenting, affecting her daily activities and overall quality of life. She visited multiple doctors and took various kinds of medications. Nothing seemed to provide lasting relief. Frustrated and exhausted, Sarah heard about Nirva from a friend who had found relief from chronic fatigue through Ayurvedic treatments and yoga.
That's interesting.
Yeah. Desperate for a solution, Sarah decided to give it a try. As we gently probed into Sarah's life, Sarah opened up about the significant changes and stresses she had been experiencing. A year ago, her mother, whom she was very close to, passed away.
So sad.
Shortly after that, her youngest child left for university. And leaving Sarah with an empty nest.
Oh, sad.
Emotional pain, such as sadness and physical pain, share some of the same neural circuits in the brain. Serotonin and norepinephrine, which regulate mood, also play roles in pain perception. Low levels of these neurotransmitters are linked to both depression and increased pain sensitivity.
Oh wow, that's an interesting output. So as you say now, I remember a story, not a new research, it's about Hippocrates and he's one of his clients or patients. So there is this lady called Telisila. She visited Hippocrates after trying with a lot of physicians. Nobody was able to understand what is her condition. So everyone were baffled. So when she reached Hippocrates, he took a different approach. So he questioned her about her past events and he asked her a lot of questions that probed her to think about her past. So in that one particular session, she was able to recollect a violent storm by the sea and she was seeing that as a child. So after that, Hippocrates said her to write about the incident very detailedly in a tablet. So I think it's something similar to the journaling, right?
Yes, indeed. Journaling is very effective in that sense.
Yeah. These tablets are even preserved till now in the Greek god of healing, Asclepius. So I think these are some instances from past which we can see that recollecting the past incidents has helped in healing, right?
Absolutely. This is, by the way, is a very interesting story. There was a study by Northwestern University, which was published around, if I'm not wrong, back in 2015. The paper was about how traumatic memories hide in the brain and how to retrieve them. Some stressful experiences, such as chronic childhood abuse, are so overwhelming and traumatic. The memories hide like a shadow in the brain.
Yeah, it's true.
There are two amino acids in your brain, glutamate and GABA, which are like the yin and yang of the brain. Directing its emotional tides in a person and controlling whether nerve cells in your brain are either excited or inhibited. Under normal conditions, the system between these two is balanced. But when we are hyper aroused and vigilant, glutamate surges. And any imbalance or dysregulation of these two play a role in chronification of pain and due to imbalances, inhibition and excitation in adults.
So I think in every Eastern philosophy, either be Ayurveda or Yoga, imbalance is the disease, right? It could be physical, mental. I think even the amino acids has this combination and that causes a lot of issues.
So the whole point is to find out the shadow of memory that is hiding in your brain and bringing it straight up.
So that works for pain. Like as you said, for the psychosomatic disorders, post-traumatic stress disorder, anxiety, and so many things.
So if you look for it, you will find many proven cases apart from research publications, like from experienced psychologists, that reconstructing memories actually work like wonders in healing process. So you must actually read this book titled Through Time into Healing by Dr. Brandweiss.
I have heard a lot about him. He's been quite famous for his past life regression therapies.
Actually, that book is full of compelling stories about healing through past life regression therapy. So, the actual past life regression therapy is all about practicing hypnosis to recover that practitioners believe are memories of past lives or incarnations. So, Dr. Weiss used this method to dig out the hidden memories and heal the illness. To quote just one story from the book, he had a patient named Catherine who suffered from debilitating anxiety and a fear of water that stemmed from near drowning experience in childhood. Under hypnosis, Catherine found herself reliving a past life where she was a sailor who perished in a violent storm at the sea.
Oh my God.
Yeah, the experience was terrifying, filled with feeling of drowning and panic. So, reliving this past life trauma seemed to be the root cause of her current fear of water.
Okay.
The past life thing is another part of the story completely. But the point here is, following a session of reliving the memory, Catherine reported a significant decrease in her anxiety.
Okay.
She also felt a newfound sense of peace about
water. That is something always that happens inside you. Like, why do I fear that? So if you can reason out and if we know really that it has been the reason for the unknown fear, things get so easy, right?
Absolutely.
Okay, there is something called clinical body memory, right?
Yeah.
So this body memory is sum of all the past events that are stored in memory and influence our behavior.
Yeah.
So they say, right, your emotions can be stored in your body. So that can manifest as a pain. We say in yoga, like when we stretch, like the skin and body has a memory. So that is a beautiful concept, I think, because our emotions are stored in different parts of our body.
Absolutely. And this can be of any type, like tactile, that is touch or motor or any painful sensations and introspective experiences and some emotions. So studies say that it has a lot to do with how our behavior gets changed in the later part of the life.
Okay.
So, and interestingly, particularly when body memories are implicit, like very tiny and shut down somewhere deep, they are not easily accessible to your conscious reflections.
Yeah.
These experiences don't pop up in your day-to-day life or even during important life events, but they may impact you at any given moment of time, and particularly during emotional experiences.
Yeah, so sometimes we think that we don't know why do we react to such situations in this way. We are not like that. Suddenly we pop up and tell something. So I think this is because of that implicit pain and memory stored inside, right?
Yes, yes. Okay. Already the founder of psychotherapy, Sigmund Freud, assigned an important role to memories and in particular the expression of distressful memories.
Okay.
He says these memories are often present in the form of bodily symptoms. And that is why we use this memory techniques to wipe out the negative body emotions and bring positive memories in Smriti meditation.
Okay, so that's interesting. We are rewiring the inner memory and we are trying to enforce the positive things, right?
Absolutely. So it's kind of like the processing positive memory technique. That's one technique we use. Another one is healing from grief by giving you bouts of dopamine.
So dopamine, the happiness hormone, right?
Yeah, but dopamine isn't just a happiness hormone. We usually say though, you also get dopamine when you yearn for something, a desire to move forward and get it. Like for example, there is something, say a piece of cake on the table and you are really hungry. You reach out for the cake and the cake moves further away.
Oh my God.
So you get up from and where you are sitting and walk forward and to try to get it. But you still don't reach the cake, but you keep walking in a desire to get the cake.
Yeah, that causes lots of frustration.
This is self-motivation and a desire to reach the goal.
Oh, okay.
So this is how dopamine works in the body.
Oh, okay.
So this is true when we are hungry and we want to eat. This is true when we want to reproduce. This is true in every state in which we are reaching for something outside our immediate ability to give that thing to ourselves.
Okay.
So dopamine is all about placing us into a state of desiring for things and continuously seeking for them.
So all these things happen in a single Smriti meditation session?
Yes, not in one session, but in multiple sessions, maybe 3 or 4, according to the response of the client. It's all about digging up something that you have forgotten, maybe negative or positive, and heal your body through your mind. So I had a client who's actually a doctor.
Okay.
And she's from the secondary care hospital run by NHS.
Okay.
She often used to refer many of her cases for speech therapy, CBT, and hypnosis.
Okay.
At many instances, such therapies never gave any significant outcomes.
Okay.
That's what at least she opened up with me.
Okay.
And sometimes their conditions even aggravated after therapy.
Oh my God.
What she interestingly noticed is that Smriti, being therapy through meditation, never let you push your boundaries unless you really want to do it.
That's interesting.
Yeah.
So it's kind of you have the control.
Yeah, absolutely.
Okay.
That's the beauty of it.
Yeah.
And thus you have a full control over your progress during sessions.
Okay.
And that is what is different about Smriti meditation than any other type of traditional psychotherapy.
So the traditional therapies create a fear factor. What we are going to say to the therapist, will I be going with the flow and will I be not in control, right? I think the most interesting factor in Smriti meditation is we have control over it.
Absolutely.
And that is an amazing session, Dr. Naveen, because it's something very new and it's very needed for everyone. Thank you so much. And for everyone who is listening to it, if you would like to experience or know more about it, book a session with Nirva. Thank you, Naveen. See you soon in next podcast.
And thank you for doing such a wonderful session.
Thank you.
Abirami. Take care.